Welcome to the Popped Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today's episode is going to be focused on the highly dramatized moment that we see in movies and media, but tends to be very different in real life, and that is your water breaking. I'm going to be referencing my iPad quite a bit during this episode because a lot of this information I've gathered from many sources. One being doula clients in the moment, what they're feeling. Two being move moms who come in postpartum for adjustments or postpartum adjustments and they share their birth story. And third, where I get most of this information from is questions that I've been able to ask labor and delivery nurses. So I want to give a huge shout out to labor and delivery nurses for one, all that you do, two, the openness you guys have to sharing your wealth of knowledge with those who ask. Um, I've learned so much from you guys, and I always am so excited to see who the nurse is going to be on duty, who we're going to get to work with, because it's usually somebody different, and I usually get to ask new questions and get new perspectives. So I really appreciate all that you do. Thank you, thank you, thank you. Keep being awesome, and thank your labor and delivery nurses if you get a chance, because they really are so intelligent and they provide so much help and work and care and affection during labor and delivery. So let's get into it. We're going to start with the amniotic sac and its role in pregnancy. So the amniotic sac itself is a bilayered sac. It has two layers, an inside and an outside layer. The inside layer protects baby, while the outside layer also protects baby, but it contributes to the formation of the placenta, which is pretty cool. The sac it creates a very protective environment, not only cushioning baby from external pressures, but maintaining a constant temperature, aiding in fetal lung development, and also facilitating fetal movement, which allows the musculoskeletal system to grow and evolve. So amniotic sac's pretty cool. The fluid inside the sac, the amniotic fluid, is the water, when your water breaks, that is coming out. That fluid, it changes throughout pregnancy. So at the beginning of pregnancy, it's mainly made up of maternal plasma, so from the mom. Later in pregnancy, more of the fetus urine is more of a contributor to the amniotic fluid than maternal plasma is. So as baby progresses, they're going to start excreting more fluids, urine, ingesting that urine, excreting that urine to start creating a very fluctual state of amniotic fluid. That fluctual state allows baby to keep taking in what they need, putting out what they don't need, but maintaining a safe environment for their body to keep developing. So in that way, babies are so smart and so cool that they can maintain that homeostatic environment throughout pregnancy themselves by taking in and pushing out what they need. Moving on to the water itself, its position or where it's at during pregnancy, labor, and birth. Amniotic fluid can be all around your baby, but as your baby drops into that birth canal or pelvis, and then into the birth canal, I want you to think of this part less about water in front or behind a baby, but more in terms of the path baby is going to come out. So we have forewaters and hindwaters. The forewaters, if your baby is like a cork in a wine bottle, when the baby corks that hole, the water ahead of baby's head is considered forewater. Any water behind that suctioned cork position, any water behind is considered hindwaters. So as baby wiggles out the birth canal, you can have different amounts of amniotic fluid coming out because there's water all around being released at different times, depending on baby's position as they come out of mom. So Going off of that, we're going to go into the different types of membrane ruptures, or the different ways that your water can break. So first we have spontaneous rupture of membrane, also known as SROM, SROM. You can also just call it spontaneous rupture of membrane. But this occurs naturally, and naturally in the sense that there's no artificial way of breaking your water. Water just breaks. This is what we often think happens before labor happens, or before contractions happen, where water breaks and then you go into labor. That actually only happens about 10% of the time. 90% of women have water breaking during active labor, when you're already contracting, which I think can be quite a big surprise for most women who imagine. I mean, even if you just sit here and imagine right now, you imagine your water breaking, what do you picture? Typically, a gush of water where you're like, oh my gosh, my water just broke. That's only happening in 10% of women before contractions happen. And even then, it's not usually a big gush of water. So, that spontaneous rupture of membrane, it happens naturally. It typically happens during active labor, and it can be a big gush, but most likely it's going to be a slow, continuous trickle. When it happens before contractions actually start, that's only about 10% of women, and that's actually called premature rupture of membrane. Premature rupture of membrane can happen at any point, typically past 37 weeks gestation, but can happen at any point, and then usually within 24 to 48 hours, women go into labor or start contractions. That timeline can be open depending on where you're planning on birthing. So this is a question to ask your birth providers or your birth team, so that everybody can be prepared for if your water breaks early, if you have premature rupture of membrane, what you're going to do or what your plan of action is going to be with that time window. I have research saying that 95% of women who have premature rupture of membrane will go into labor or start contractions within 28 hours. So that's important with that timeline of a typical 24-hour standard. If you haven't started contractions by 24 hours, they tend to want to start interventions at that 24-hour mark to get labor progressing. That time mark is more in reference to risk factor for infection. Most birth providers are trying to avoid as much opportunity to infection or bacteria starting infection as possible. So they're going to want to get labor going if it hasn't started within 24 hours. Now, I'll rewind a little bit. I've heard some home birth midwives waiting for 48 hours. That is really different across providers. That's why I always encourage moms to ask their provider or ask their birth team what the plan's going to be, so that you're not in the moment like, oh my gosh, now it's been past 24 hours. What do we do? Have the plan, know what you're going to do. I say all that. This only premature rupture of membrane really only occurs for about 10% of women. Most often, water breaking or spontaneous rupture of membrane is happening during labor, like I just said. So, moving on, we also have preterm premature rupture of membrane. So, it's what I just talked about with PROM, but now this is happening prematurely, so before 37 weeks gestation. This type of water breaking tends to be more medically monitored because most birth centers and home births require moms to get to 37 weeks gestation to have their birth in that place. When we're before that 37 weeks gestation, there's higher risks for lung infections, bacterial infections. So moms typically go into the hospital to be medically monitored to make sure that that infection is either not happening, but also sometimes premature rupture of membrane can be stopped. So labor can be stopped for some moms depending on the actual rupture, the rupture site, and what the provider is able to do to stop that labor. That is also super rare. That's like 3 to 4% of pregnancies and fluctuates even lower than that. Moving on to artificial rupture of membranes. This is what is typically happening in the hospital, sometimes in birth centers too. I guess, let me rewind. I guess this really happens with pretty much any version of birth or any birthplace, depending on who your birth team is. But this is typically happening if your labor has started and is not progressing and your water hasn't broken yet. So, an artificial rupture of membrane is classified as a medical procedure. That's why this is typically done by midwives or OBs. It includes a obviously sterilized small metal rod with a small hook on the end, usually placed in the birth canal. I mean, where else are you going to place it? Placed in the birth canal, and they create a small tear in the bottom of the sac so that the water can break. This can be really beneficial for a couple different reasons. One, for the birth providers to assess the characteristics of the amniotic fluid. So if there's green or brown, seeing if there's meconium within the amniotic fluid, signaling that there could be some fetal distress. It also can be an indicator of if the water not breaking is what's keeping labor from progressing, which I know is kind of a bummer that you would have to find out after, but like I just said with that story of that mom, with the water breaking, it was keeping, without her water being broken, it was keeping her baby from dropping lower into the birth canal. Sometimes that's what we're trying to affect in the hospitals or in birth centers when we're trying to get baby to move lower. So typically, this can increase or intensify labor rapidly. Sometimes immediately, sometimes not so immediately, but it does ramp up. It's because we're taking away that cushion away from baby's head, and baby's head is now able to drop lower onto the cervix, creating more pressure on the cervix as well as the pelvic bowl. So, can intensify labor quickly. Actually, I think I said that I said this, but I didn't. So I'm going to tell a quick story. I have a mom who was on her third pregnancy, and the first two had some interventions, and then this pregnancy she was really wanting to have a natural unmedicated birth in the safety of a hospital. Not that your home isn't safe, but that's what she was wanting. Anyways, this was her third baby, and she was 7 centimeters dilated, and she was sitting on a birth ball laughing and talking to me during and in between contractions. We were like, what is going on? What is happening? And this was because of what we talked about earlier, forewaters cushioning the baby's head. She had so much amniotic fluid ahead of the baby's head in the forewater that when baby was trying to descend, making some impact or putting some pressure onto the cervix for it to continue dilating, the water was cushiony enough that the cervix wasn't dilating anymore. So she sat for quite a few hours with really manageable contractions, but nothing was changing in her cervix dilation or effacement. So after a couple hours, her birth provider was telling her, I'm pretty sure that your forewaters are keeping baby from actually getting that pressure onto your cervix to keep labor progressing. If we do an artificial rupture of your membrane, we're probably going to release that fluid ahead of baby's head. So baby's head's going to drop lower, labor is going to start to intensify, and contractions should pick up. Sure enough, we waited until she felt comfortable and she was like, okay, I'm ready for labor to continue to progress. She asked the provider to come back in and perform the artificial rupture of membrane, and within 2 contractions she was feeling everything. It went from happy giggles to nobody touch me. This is really intense. And her baby was born within an hour and a half of that artificial rupture of membrane. So it can intensify labor really quickly, depending on how many labors and births that you've had. But anyways, let's keep moving. So Moving on, we have high leak and slow leak. This more refers to the first three that I talked about, which is spontaneous rupture of membrane, premature rupture of membrane, or preterm premature rupture of membrane. Typically, and I'll get to why, this typically doesn't happen with artificial rupture of membrane because it is we're going straight up the birth canal. We're not going up and around where baby is, but it's happening right at the bottom. So we're having a low break, low leak from the uterus. A high leak, slow leak is when we have a more natural rupture of our membrane, whether it's one of those first three that I talked about, and there's a small tear higher up in the uterus, creating a slower leak. So a lot of times when this happens, it can go unnoticed, or you can not notice that your water has broken because it can resemble discharge and not continuous leaking fluid that you can't stop. It's just like slow, drippy drops. So often, if this is happening, and you can't tell, because at some point you're gonna be like, okay, it's like not drying up down there. It's continuously wet. And you're like, can't tell if my water broke or if it's a discharge or if I'm peeing my pants. Like, what is happening? There are some providers that can provide a paper test to see if the fluid coming out of you is amniotic fluid. Those two tests are the nitrazine paper test and the Fern test. And that's just to test the characteristic of the fluid to see if it is amniotic fluid, urine, discharge, etc. But it really should just be those three. So hopefully that covered everything there. I will come back and say, now that we've gone through the different ruptures of membrane, I had a patient who postpartum was telling me her birth story, and she said she could not stop laughing because she couldn't stop laughing during labor because they kept saying, like, my water, like, she had so many different times where she had gushes of water coming out. And she kept saying, my water's broke. Like, my water's kept breaking. My water's kept breaking. So, what that meant for her was the way that her baby wiggled out of her uterus or out of the birth canal, because of the different ways that the baby is wiggling back and forth, which they will go through flexion and extension positions. We'll talk about that a lot more in a different episode. It was releasing different amounts of water into the forewater position and then releasing out of her. So she would have these semi large gushes of water that would feel like, oh my gosh, my water just broke again, but really is just a release of more fluid coming from different sides or around the baby as baby wiggled their way out. So if that's something that you experience, it's pretty cool. I want to hear about it. Definitely send me a DM because I want to hear that story. But yeah, that's possible. You can feel like your water's breaking multiple times throughout labor because of the way that the baby's going to wiggle out. So, the last thing I'll say about all those different types of membrane rupture, those can all happen in big gushes or small trickles. That's why when I said at the beginning of this episode, it's a highly dramatized event that we always see just this big gush of water. And, oh my gosh, my water broke. It doesn't typically happen because it's more typically a slow leak, whether it's any of those different forms of water breaking. Even the artificial rupture of membrane isn't always a huge gush. So, something to keep in mind, you may never experience that huge gush of your water breaking, even when your baby comes out. So, might just be a slow leak, whether it's high or low. Keep that in mind. Some more physically aware people can have a slow leak and be like, okay, my water just broke and I'm feeling it, the pressure in my stomach slowly decrease with that fluid. Other people who aren't as physically aware of what's going on in their body, not your fault, just who we are, tend to miss it. So it's important to be aware of different ways that this can happen. It's also important for your partner to be aware of these different ways that can happen because when we're pregnant, we're not always in the full right mind, because sometimes there's stress and there's fear, and when we're in a stress state or a sympathetic state, it's hard to think through these seemingly normal reasonings. You'd be like, oh, okay, my water is broken, but it's slowly leaking. What else? We don't always think that way. A lot of times we're thinking very fast. What's next? What do we is this happening? Is this happening? So when your partner is more aware of what could happen or what is happening, it's helpful to have some support other than you just being the sole knowledge bank of what is going to happen during your birth or what could happen. So anyways, let's keep moving. We're going to go into recognizing the signs of membrane rupture, recognizing the signs of your water breaking. So, like I just said, some people will be super aware, some people won't be as aware, or might be a little bit more confused and need some more confirmation to understand this is what's happening and this is where I'm at in my pregnancy or labor. So, the physical signs of your water breaking, typically a sensation of fluid leaking, whether that's a big gush and you just feel like your pants just got soaked. It could also just feel like leakage, but it would feel different than pee leakage. Pee leakage, you can be like, oh my gosh, am I leaking pee? And you can close that sphincter with a thought. You just think about like, oh my gosh, I'm not supposed to be peeing right now. You can usually stop peeing. This slow leak of amniotic fluid, once your membrane's ruptured, you can't stop it. It's unstoppable. You can't hold it back. So again, that can happen in a sudden gush, making your pants wet. It can also be a slow trickle that happens over a long period of time. Amniotic fluid is typically clear and odorless. It can have a sweet smell, but if you notice when your water breaks that it's not clear, or if there's some color like green or brown, that can be signs of meconium inside the birth canal or inside the amniotic sac, which can signal or indicate that baby is in some distress. Not always, so it's not something to immediately freak out about, but it is something to be aware of and alert your birth team or your birth providers so that you guys have a plan of action and it doesn't just go untalked about. It is something that I do believe should be discussed with your birth team if that's something that you notice when your water breaks. Moving on, if you're still not sure, if you're like, I can't tell if my water's leaking, I don't see any fluid, I can't tell if this is different than discharge or pee leakage, you can lay down for 30 minutes and then immediately stand up. And if you notice the leakage increasing, that typically means it's amniotic fluid. But you can also use a sanitary pad to see the color and the amount of fluid that's coming out of you. I highly recommend if you're going to do the pad or something to see the amount of fluid, don't use a tampon. If your water has truly broke and we're trying to assess that, if you put a tampon that could possibly have a little bit of bacteria, we're introducing bacteria into the vaginal canal, and we do not want to introduce any bacteria into the vaginal canal once we know that the water has broken. If we're not sure if the water has broken, let's just be safe and not introduce anything new into the vaginal canal. So, in other words, no intercourse, no tampons, try to keep it clean. If you're not at a hospital being monitored, or even if you are at a hospital being monitored and you want to be aware of what's going on, or if you're at home or at a birth center, these are typical signs that your birth team or your birth providers are going to be looking for to see if there's any signs of infection once your water has broken. And that's going to be an increase in mom's heart rate or temperature, uterine tenderness, different than contraction tenderness or hip pain or sciatic pain. Like it's gonna hurt to touch your tummy, like hurt. And then this word always makes me laugh, but foul smelling discharge, bad smelling, anything that's like, this is not a good smell, this is a bad smell, this is bad smell, they're probably gonna be like, oh my gosh, we might have a sign of infection. That's when they're probably going to check with those other indicators, heart rate, temperature, and any uterine tenderness to see if that's what that sign is leading to. Okay. I think we're doing pretty good. Let's get into some common questions that I've received in practice, some questions that I've seen asked at labor and delivery, common questions. So, can you make your water break? I get this one all the time. Unfortunately, there's no proven way to break your water. You can ask a million moms, and my guess is that a decent amount of them could say, this one thing made my water break, or this one thing made me go into labor. Like we said all the way before, only 10% of moms are going to have their water break before they go into labor or start contractions. So, one, that doesn't even really matter. um, Two, the movements that we do, like curb walking or big squats or jumping into a pool or just like big pressure changes, often isn't enough to actually break your water because, like we talked about at the beginning of this episode, amniotic fluid and your amniotic sac creates such a protective environment for your baby that those external pressures aren't really going to affect the internal pressure the baby's experiencing. So that is something to keep in mind. There's no proven way. I do encourage moms to try all the different things though, because it keeps your curiosity up for what's about to happen, but it also keeps you involved in starting labor. It keeps you proactive in participating in an event that you are going to be solely responsible for participating and completing soon. So I encourage you to try all the things anyways. It's fun. Why not? Um, when my water breaks, does labor start immediately? After listening to this episode, you should probably be able to answer this. No, not always. It can, but typically, no. It does usually within 24 hours, but not always. Sometimes, but there's only 10% of women who are having their water break before contractions start. So, within that 10%, 90% of those women are going to start contractions within 24 to 48 hours. So, be thoughtful of that. Just like we talked about the whole episode. Can your water break without you noticing? Absolutely. It depends, like I said, how physically aware you are of your body and your female anatomy. Um, Especially with high leak, slow leak, it's more commonly missed. Water breaking is more commonly missed because typically high leak, slow leak, that leak of amniotic fluid has a much longer pathway to get to the birth canal and can pick up other proteins, other stuff as it comes down and can become thicker so that it comes out more of a discharge consistency than a watery consistency. So it can be missed. Um, Again, everybody's different. It really does depend on how your water breaks and then how physically aware you are of your body and what you can feel or notice when that water breaks. Where are we at? What if my water never breaks? This happens. It's really rare, but this does happen. This is called a a baby born on call, ENCAUL. That means a baby is born inside an intact membrane, going all the way through the birth canal. Sometimes babies or water doesn't break until transition or in the middle of pushing, but it can also never break as baby comes out. That only happens 1 in 80,000 births, so very rare. But baby on call, being born inside an intact membrane. Typically the sac is ruptured by the birth provider, somebody on the birth team. I personally haven't seen a mom do the sac, but it's not to say that she couldn't. But it's typically ruptured by a provider. Many providers will perform the artificial rupture of membrane if labor isn't progressing. That tends to happen before we get to this point. But like I said, there are some babies where labor can progress. There are some babies and moms where labor can progress all the way through pushing without the water breaking. Um, does keeping the amniotic sac intact make labor harder or easier? These are actually more like pop quiz questions. Maybe we'll introduce that segment of pop quiz to the Popped podcast. But after listening to this episode, you should probably know the answer to this. When the sac is intact, because we have that amniotic fluid, that for water cushioning baby's head, tends to be less intense contractions, more enjoyable labor. Once the water breaks, tends to be a more intense, harder labor. So this also, keep in mind with what I just said, with some midwives preferring to keep the membrane intact if possible. If we keep it intact, we can decrease the risk of a prolapsed cord, which is pretty cool. And so, yeah, that's what I have. We have decreased risk in prolapsed cord and less pain, but both we've already talked about now. So, if your water never breaks naturally, does not necessarily mean there's something wrong with you. As long as your labor is progressing and moving forward, there's really no immediate need for intervention to break your water. But again, that's up to you and your birth providers to decide. Everybody's different. Some people want labor to go quick. Some people don't want any interventions and just wait and wait and wait until we do have some more progression of labor. Some midwives can perform or provide some herbs or some other teas that can help increase some pressure so that the water does break or so that labor can continue to progress. But options, these are all just things and information to give you to continue to keep up the curiosity of what could happen during my labor and how can I be prepared. I don't want you to be stuck with like all these different things could happen, but I want you to feel comfortable in knowing all these different things could happen. But because I know what could happen, I'm well prepared going into my labor and birth because I know if this happens, I know what's happening when that happens. If this happens, I know what's happening when this happens. So, all of this is just information for you to be more prepared in the moment, not necessarily to have some long list of all these notes that you have to memorize and keep track of so that you can remember for your birth. The things that stick with you will stick for a reason. So keep listening to this information because at some point it could be really important during your labor and birth. It could be really important for another mom or a friend that's expecting a baby. So keep staying curious. And I want to hear from you. This is one of my favorite aspects of labor is hearing the different stories of how your water broke, when you noticed it, if you noticed it, was it during labor, was it before labor? So I want to hear your story. Did you have some dramatic gush of water and oh my gosh, my water broke, or was it more of an uneventful moment that led you into the rest of your labor and birth story? You can always DM me your stories. I would love to hear them. If you're ever open to me sharing them on the podcast, please let me know in that DM. You can send me messages on Instagram at Dr. Emily Muery, but you can also send them to the Popped Podcast or Popped Pod on Instagram. You can also tag me in your birth stories. I love to read birth stories, and I love even more to share birth stories because the more stories accumulated is more preparation that you walk into and more of an army on your back of all the women who have gone before you and done this successfully and came out on the other side. So share your stories. Don't stop sharing your stories. And if you're open to having other people hear your shared story, please let me know because I'd love to share it here on the podcast. If you found this episode insightful or helpful in any way, please share with another mama to be. Be sure to leave us a review, subscribe, and like our channel because it really does help. And stay tuned for more real talk on pregnancy, birth, postpartum, and so much more. I had so much fun talking to you guys today. Stay informed, stay educated, and keep moving towards the birth that you deserve. I am Dr. Emily Muery, and you've been listening to the Popped Podcast.